Hello, welcome everyone. My name is Trina Becker and this is Beth Bergstrom, and we are your speech therapy PD presenters for today's epic case on executive dysfunction. Before we get started with the presentation, there are a few items that I need to alert you to. This course is 60 minutes and will be offered for 0.1 ASHA CEUs. Our disclosures for this evening's presentation include intellectual property rights and royalties from products sold on the B&B SLP Teachers Pay Teachers store and also on our website, bbboutiqueslp.com. We do not have any relevant non-financial relationships to the content of tonight's course. If you have questions during our presentation tonight, please put them in the chat box and we will address them at the end of the course. And this concludes our introductory material, so we're ready to get started. As I mentioned, I'm Trina Becker, and this is Beth Bergstrom. We both teach at Eastern Illinois University. We're instructors and clinical supervisors in the Department of Communication Disorders and Sciences. We both love to share our passion about our profession with others through presentations and social media and through creating resources for SLPs.
And you can tell which one of us traveled to somewhere sunny over break.
Yes.
Oh my gosh,
Sorry.
I look like a ghost. Okay. Did you finish?
I did. Tonight we'll be presenting an epic case study on executive dysfunction. Our learning objectives for tonight's course are to critically analyze case history and other information to determine etiology or underlying factors or symptoms, to develop a profile of strengths, needs, and functional impact to determine treatment priorities, and to determine the most effective treatment approach using client values, clinical judgment, and research. This is our handout for tonight's course. You have a copy of this that you can download. This is our guide for client-specific intervention. This is based off of ASHA's ICF model. So it just gives you a guideline, walks you through how to derive at those client-specific intervention goals and treatment. Our topic tonight, as we've said, is executive dysfunction and developmental language disorder. Our client we're going to be talking about is Simon, who is currently age 11. The complaint is independence, consistency in his performance, and writing for academics. We're going to start with etiology as the foundation for our client-specific treatment, and we have seen Simon in our university clinic for several years. So here's a little bit about him. He has a history of torticollis as an infant. He needed occupational therapy and physical therapy for body awareness, balance, and tone. Initially, he was referred due to phonological awareness around age 6. He had some early reading difficulties showing up. Also, phonological memory and verbal memory deficits were a concern for him. In first grade, his teacher wanted him to redo first grade because she was seeing some significant academic concerns. So this was kind of a big red flag for family, really made it prominent that he really needed some more intervention and we need to dig a little deeper to figure out what's going on with him. He has a history of an articulation disorder, early concerns with expressive language, specifically syntax, early concerns with working memory and word retrieval, comprehension and formulation problems that look like pragmatic skills. So it looked like he had deficits in pragmatics, but it was really about his understanding of the information during a conversation or
knowing how to respond. Yeah.
And formulating those sentences due to his expressive language, and processing speed has always been a concern of Simon's. This is a little background about his academics. So as I said, after first grade, is when it really became kind of blaring, when the first grade teacher said she wanted him to repeat first grade. He has had difficulties learning to read, specifically with phonological awareness. In third grade, his issues showed up in math and word problems specifically, and also reading comprehension. Memory and EFs became a concern throughout his academic career. In third grade, writing also became something that teachers and family were concerned with. He was unable to do some of those written response to prompts. For example, what's your favorite food and why? So he was really blown away by that, couldn't put that response together. He had noted significant issues with grammar and use of parts of speech, difficulty generating a sentence when given a specific vocabulary word. He had sequencing problems and issues with procedural memory. He also had significant difficulties with recall of 5-word sentences. So he would often leave out words, including small words such as articles. He would change words when he was reciting a sentence back to his clinician, and he would use wrong parts of speech. Other professionals, he's received occupational therapy for tone, balance, and body awareness. He has received several years of private tutoring, specifically in the summers, to keep him up on his schoolwork and reading comprehension, and math. He had speech and language therapy through our university clinic and private speech therapy often during the summers. And it's important to note he is in a private school with no special education testing or services, but the school did grant him a 504 plan with accommodations. So our key findings from etiologies, what are our takeaways here? We need to note that he has global concerns starting really early in development. And it seemed like all aspects of development were impacted, from his motor skills with the OT and the PT to cognitive skills that are showing up in his academics. This resulted and had a significant impact on early learning and academics. So some of those foundational reading skills were already a concern starting at that kindergarten, first grade level, and continued to progress into math issues and writing issues. Overall, inconsistent progress in speech therapy with persistent problems. You'll see as we talk through some of his challenges that he's had the same kind of thing showing up year after year.
And he's been getting a lot of therapy through the years. It's not like we haven't addressed these issues in the past through whether it was motor, whether it was cognitive, whether it was special tutoring, outside speech and language therapy. I mean, we've been addressing these, and these problems just seem to persist.
And then new problems come up when difficulty levels increase. So when you had new challenges in academics, okay, now at 3rd grade, we're going to use these writing prompts. Now we have new problems associated with this. So poor guy has had lots of challenges. Here's some information about his assessment that we've gathered through the years here at EIU in our clinic.
Not exhaustive, but just some of the tests that he's had.
So articulation errors are mostly in those later developing sounds, specifically TH and R. If you look at his language assessments, you'll see that a lot of his skills are within that average or low average range. We bolded a couple of things that we wanted to point out that are on the little bit lower side. So his lexical semantic index on the CASEL was an 83. His syntactic index was an 85. So those were the lowest of his language skills on the CASEL. Also, if you're looking at his language sample, one thing that we wanted to note were the number of mazes. We felt like that was a little high for him. He used a lot of filler words when he was talking. He would start a sentence, abandon it. It was just overall confusing when he would talk. So that's important to note and point out. And then finally, with the auditory assessment, his auditory memory index was the lowest of all scores. And you'll see as we go through his case that that is definitely a primary concern. This is just a snapshot of the brief. So we did have mom fill out a brief to look at his executive function skills. At the time that this was filled out, his teacher was on maternity leave, so we don't have a parent or a teacher's brief to show you. But you can see that mom definitely had some concerns overall with his EF skill. So looking down that row, almost every single area, and significant concerns there. So she was noticing that as something that she was really worried about. Okay, so key findings from assessment. Overall language skills were low average range, high number of mazes in his language sample. He has worked on TH and R, but has had persistent difficulty with that R sound. EF skills were a significant concern of mom. Auditory memory was the most concerning with all of that assessment information. We kind of were talking about just looking at his assessment. He might not qualify for speech language services on some of those assessments because they were in the average range.
Yeah.
But we're going to talk about what significant deficits he does have, even though that some of that testing didn't show it. Also, procedural language samples were significantly impaired, and I think you're going to see an example of that in a video in a second.
Yeah.
So his application of the skill areas are more significantly impaired than during that static testing. So in real life functional situations, these deficit areas are showing up more. Persistent problems, as we mentioned, they've been occurring throughout the time he's been here. They change with the demand. And really, he doesn't have one at this time. We're going to get to his diagnosis, but not best represented by one thing. Like we really need lots of different things were happening with him.
I have it here for you just a little bit of an informal assessment that we did with him when we were working or beginning to work on some sentence recall. One of the things that we noticed is that if we said a statement of 5 words, maybe we were using some of his vocabulary words from school and put them in a sentence and had him repeat those. He was having trouble even with like 5, 6 words. We really felt like he should be able to do 7, at least 7 or 8. And then we wanted to kind of see like where was the breakdown. So one of his vocabulary words during this informal assessment was commenced. And so the sentence was, she commenced reading a book when it started to rain. And you can see that he just barely changed the sentence. And what did he change? He changed the verb. So oftentimes he will miss the verb, put a different verb in, change the verb tense, something like that. For example, on the second, he said the strapping young man helped carry the heavy furniture into the house. That's what we said. He said the strapping man helped heavy into the house. What did he miss? He missed an adjective. He again missed a verb phrase. He missed a noun. He was missing entire parts of the sentence. So if you look down at the missing items, you can see that he often had errors with verbs. He often had errors with the middle or end of the sentence. So he might be able to remember kind of the beginning, but then he kind of lost the end. So we're going to talk about this a little bit more when we get to some therapy techniques, but I wanted you to see kind of a little bit of this informal sentence recall. So here is an example. Did I hit share sound? Was it already? You guys let us know right away if you don't hear any sound. Okay, we did a sound check and now I don't know if I hit share sound. This is a little video of us giving him some instructions. So this happens to be about a 5-step directive. And I want you to see, what parts of it he gets and kind of what happens when he misses the instructions.
Can you give us a thumbs up if you can hear?
Here we go. Get out a piece of paper.
Thank you.
Thank you.
Oh, I stopped it.
Place your hand flat.
Let me start that over for you.
Here we go. Get out a piece of paper. Place your hand flat on the paper. With a pencil, make an outline of your hand on the paper. Write your name inside the outline of your hand, then flip your paper over.
Just like my last name.
Do you guys remember the last step?
repeat it?
Alright. Get out a piece of paper, place your hand flat on the paper. With a pencil, make an outline of your hand on the paper. Write your name inside the outline of your hand, then flip your paper over.
Okay, he got it. Now, I mean, it's a little painful to kind of watch that. And you think about him in a classroom, a sixth grade classroom, probably all instructions are probably anywhere from 3 to 5, maybe even more directives. He would have the added benefit, I think, of looking around at his peers to probably see what they were doing. But he also maybe wouldn't do that in a timely manner, and he would already be behind for the next set of instructions. So just doing some really informal things like, where is the breakdown? What does he do? How does he respond? What does he say? Can really be helpful in kind of knowing the kinds of things that we might need to be focusing on. Okay. I also have a little informal assessment video of a language sample. This is a procedural language sample. So we're asking him to tell us how to play a game, and we're listening for procedural language like steps, sequencing, only the relevant details, probably listening for first, next, then, finally, things like that. So here is a little sample of his procedural language for how to play Uno.
You play Uno.
How you play Uno is you take out the cards. There's probably a thing around it so it won't come out in the cardboard thing, kind of box. You take it off and then you read the directions. It says you have 7 cards. It could be either yellow, blue, red, or green. And then there's some like things that can give you an advantage, like add 4 or swap hands or anything, and then change your color or whatever you want. There's some zeros, like zeros to skip someone. Like if you draw 1, the other person that you give it to doesn't have a chance of getting to play the next round. You try to go until you have no cards left. You can have as many cards as you want, but that's not going to help you. But yeah, that's basically it. So.
Okay, can you play Uno?
I can't play Uno.
I mean, he said everything that was relevant to Uno, but it was really details of the game, like the colors and some of the cards. He named some of those, but there were definitely, first you're going to deal out 7 cards, and then the first person is going to play the same color or number as the card that we flipped over. I mean, there's no real procedure. I mean, he has a really difficult time doing this. I mean, I think if he were to tell someone, a classmate, how to do that, they would be like, I have no idea how to play Uno.
You play Uno.
Okay, and then this last little sample that I have, I hope, where did it go?
You play Uno.
Oh, it may be later. I wanted to just give you a heads up here before the next video about what procedural memory is. They call procedural memory the how-to knowledge, like how do you do something? You can really know how to do it. To be able to explain it is another story. So procedural memory and developmental language disorder, which we're going to be talking about, are connected because developmental language disorder involves difficulties with implicit learning, which is necessary for procedural memory. So implicit learning is also very crucial for learning things like grammar rules and word sequences. We do that kind of implicitly without really thinking about that. Language learning relies heavily on procedural memory systems, especially for syntax and morphology. So there's evidence that deficits in procedural learning, which may explain why individuals struggle with grammar and sentence structure. If you remember back to his etiology, expressive language in the area of syntax and verb forms, those kept coming up, and they've been there as long as I can remember. Okay, here is one more little informal language sample as a assessment piece. And this is on a personal narrative. And I want you to think about kind of what's missing as he's telling this information about a surprise that he got.
You're supposed to tell me about the surprise you got this weekend when your sister came home.
Why is my mom telling you everything? My mom got me two guinea pigs.
No way.
Because I had a guinea pig. There was a guinea pig from 5th grade that was like a class pet. And then my teacher left because she had another job she could have done. So then my other teacher came and she was like, I can't take care of him. I don't know how to do it. He actually did pretty good when he was there. So we brought him home. We adopted him. And then over the summer, it was like May or something like that. We had him. But on July something, he passed away because he had a heart failure. So his cage has been empty, and so my mom, when my sister went to U of I to put all the stuff there, she was going there nonstop. Like she was like begging her, felt like just to come home and stuff. And she said, "Okay, I'm going to U of I have to go up there for my sister because she has her bed broken or something like that." I'm like, what? Couldn't she just have like a repairman or something like that?
Right.
Well, like okay, so. And then on that same day was this like thing at Pearson Park. So we had something to do and we weren't always at home. But when she went to Champaign, which is where U of I is, my dad went with her and they went to pick my sister up, and then they went to go pick up these two little guinea pigs called one named Fred and my mom named the other one Frazier.
Oh.
I don't know why Frazier, but okay. And so we got home. I was watching a show, and then my sister came in with holding them, but I didn't know because they usually come and sit down on the couch.
Right.
And I'm just sitting there waiting for them to come in, and then
I think you probably get the point. It's a little bit convoluted. It's a little bit confusing. I think the thing that stands out to me the most is that he always is talking about these small little details, like in the morning and in the afternoon, and her, this broke and that broke, that are not related to the story. So, how relevant is all the information? I feel like organization, he started with the punchline at the very beginning. You almost could have stopped there and we could have been, done with the story. So I definitely think that cohesion, organization, relevance, those are all things that make it difficult to kind of hear this personal narrative. Okay, so that takes care of etiology and assessment. Let's kind of go back to this worksheet and kind of think about everything that we've talked about so far.
Right. So now is the point in the presentation and our thinking through the client-specific intervention process so that we need to think about what are the impacts that his deficit areas are having on him, right? Or what are the biggest impacts?
And I think we're doing it at currently, right now, because he's had impacts in probably all these areas. But right now, what are we thinking is the biggest impact?
Age 11, 6th grade.
Yes.
Right? Okay. So I'm going to ask Beth because she is his current clinician, his current supervisor. How about auditory comprehension? Is that impacted currently?
Yes.
And oral expression, is that a concern for him?
Yes.
EF cognitive?
Yes.
And how about speech?
No.
So he still has persistent R errors, but it's not really a big focus and not really his biggest concern right now.
Right.
And his intelligibility was actually pretty good.
Yeah.
Social, is that a concern?
No, although I think
you say no and you're shaking your head.
Yeah, I think no, but I think we're really, 6th grade. We're starting to come. It has not been a problem, but I worry about it becoming a problem in the near future.
How about behavior?
No.
And sensory issues?
No, he's had them in the past, but right now, not a concern that I'm going to worry about with goals.
And written expression
Yes.
and reading comprehension.
Yes.
Okay.
So that's a lot,
Yeah.
right?
Yes, a lot of areas.
Yeah.
Auditory comprehension, oral expression, EF cognitive, written expression, and reading comprehension.
And I could have said yes to everything.
Right, but we have to prioritize.
Right.
So, of these, what are the impairments that are most impacting his daily function?
Memory. I think his task initiation, he just doesn't really know how to get started independently.
Okay.
Being able to plan and prioritize. I think that his awareness of how he's actually doing on a task, a homework assignment, and then I think just probably time management as well.
And what activities are most important for the client? His
I
needs. What are his current needs?
Yeah, I think our biggest concern right now, kind of related back to that kind of social, is the self-esteem. Again, 6th grade, I think he's aware that he's still coming to therapy. He's aware that I feel like in the past we used to say, "Oh, you're doing so good. We're almost done." And then here we are with another set of new things to work on, so that he can be successful academically. So I really think our biggest needs right now are self-esteem and making sure that he can be successful.
What current characteristics hinder him the most?
I think that right now, motivation, again, based on everything I just said in that previous statement about the fact that he's kind of over it. He's kind of defeated. And so I think motivation is becoming a problem for us.
What current characteristics are strengths that you can build on with him?
He wants to please you. He has a lot of humor. He is just a sweet, kind, I've said hard worker in the past. He doesn't really want to work quite that hard anymore, but he is still a hard worker. And he does have a really great support system, both at home and at school.
Okay. Okay. So at this point, we're going to talk, we don't do this with all of the EPIC presentations, we want to touch on a little bit of diagnoses. So our topic for tonight was executive dysfunction, but we wanted to clarify that that is not a diagnosis, but their symptoms, right? And their skills. And they're often associated with another or with a primary disorder, which we're going to touch on Simon's primary disorder next. But we just really wanted to emphasize that, and that it's really important to do a good assessment and figure out what is the executive function profile of the child. And it really varies depending on their presenting diagnoses. So again, first we need to recognize what is their primary disorder and then develop that EF profile from there. And as a reminder, executive functions are skills. They are our internal cues to keep us on task, to inhibit, to remember things, to plan, to problem solve, to be flexible and shift, all those things. So we have these foundational early developing executive functions, which are attention, inhibition, and working memory. Just reading those three makes it, every time I look at them, like, of course, those are our foundational EF skills, important in everything that we do. And then some higher level EF skills, goal determination, fluency, strategic planning and organization, being able to initiate and then persist with a task, flexibility and shifting if something doesn't go right, making those adaptations, self-appraisal, and overall regulation. So just to kind of wrap your head around what those EF skills are, and again, remembering that it's not a specific diagnosis. And when we look at EFs and when we think about treatment for them, we're not really measuring an increase in somebody's ability to inhibit, but we can measure their use of the strategies to help them inhibit. And we're going to touch on that with goals, so we're going to get a little bit of a deeper dive into that. Also, something we wanted to note with EF, that language and EF really go hand in hand, and we need to recognize that there is an interaction between the two. our behaviors are mediated through language. We use self-talk as a tool to inhibit, to initiate, to persist, and shift and plan. And then at the higher level is verbal reasoning. And the foundation of verbal reasoning is abstract language. So we need abstract language to deduce outcomes, to organize, make inferences, etc. And also just to note that functional problems associated with executive dysfunction, you can see there are lots of things there that we work on as speech language pathologists: communication, pragmatics and social interaction, reasoning, problem solving, new learning, and memory, all functional problems. So EF is just, I had a word and I lost it.
Oh,
What I wanted to say. Yeah,
Shoot.
they're periphery, right? Like we need to have those skills to build on these other language foundations. So we need to be thinking about them, but also need to figure out that primary diagnosis as well.
And I also love thinking about, if I look back at this previous slide, the foundational processes. I can never expect my clients or my students to be able to do some of these higher level components. Specifically, like I looked at the next slide that was verbal reasoning. I mean, how can they do verbal reasoning if they don't have working memory or ability to attend or inhibit? I mean, so make sure that you are thinking about ways to promote, improve, and compensate for any of the deficits in attention, inhibition, and working memory before you are expecting them to be able to jump and do some of the higher level language skills.
And as you said that, I thought
Is that
about
your word?
No,
Oh.
I thought about all those things. I was thinking about something different. All those things in Simon's language sample that we just watched about his, description of his surprise guinea pigs and how he had to attend and he had to remember and he had to inhibit, right? But he didn't inhibit. He threw in those extra details and he kind of got lost in his description and yeah.
And so in your brain right now, you're thinking, so my goals for his personal narrative, probably in the past, I would have worked on macro structure, character, setting, problem, solution, in telling a story, when really I needed to back up. And before I can even get to anything like that, I need to work on those three things that she just mentioned: attention, working memory, and inhibition. I need to specifically work on skills that are going to strengthen his ability to kind of do that. So lots of things to think about here with executive function. It really touches everything. And it really needs to be considered with every client. I also feel like in those 3 videos that you saw of his informal language samples, you probably recognize so many of your own clients. And now you may go back and think, gosh, I really didn't informally assess it for this. I was just thinking about his ability to tell a story. So I love the idea of being able to really do a deeper dive into kind of what skills you're looking at and EF skills to consider. Okay, so we said we're going to talk a little bit about a specific label diagnosis. News to me, over the last 5 years, there's been a real push on using developmental language disorder as a diagnosis. I've always just said language disorder. I've also remember hearing developmental delay, different. And then also knowing that when you're in the schools, your eligibility for a lot of your students is going to be specific language impairment. So what is that? And why is there a battle for this whole idea of terminology and label? Again, there's a little bit of an argument right now or controversy on what to call it. People are saying, SLI is not really that clear. It doesn't always reflect the clinical things that we need to be doing in the schools or in our clinics. However, at this point in time, it is still the IEP eligibility that you would use. DLD, that I'm going to talk about, is not yet in the DSM. It would just be a language disorder. How are you going to diagnose this developmental language disorder? You need to think a lot about the prognosis, which I don't know that we always really consider when we're trying to label a disorder area. What is the prognosis for DLD? it's something that you need to think about. How is that problem persisting over a long period of time if they've had actual therapy to kind of work on specific things? At age, I feel like, this particular client had problems that were noticed, probably early intervention, but then specifically at age 6 when school became difficult. And here we are at age 11, and we still have all of these persisting problems. And we've had therapy that entire time. And then I also think that it's not better represented by another condition like intellectual disability. I mean, you saw his PPVT was a 93. All of his language scores were within normal limits, low average, but within normal limits. I don't have autism. I don't have, any other condition that it would be better represented by. And we also need to know that this term or label of developmental language disorder encompasses a large range of language problems, including all of the things that we just talked about. Phonology, syntax, word finding, pragmatics, discourse, reading, writing, and then that verbal learning and memory. So all of that is also included in developmental language disorder. So why did I start to care? I think the thing that bothered me the most about this particular client is if I think about his demographic section on his reports every year, I have the same diagnosis or a new diagnosis. I've had language processing disorder. I've had expressive language disorder. I've had literacy. I've had executive dysfunction. I've had all of these different things up in my demographics. And I'm like, this is too much. What am I actually doing? And then I would, if I had language processing, then I would start working through the language processing framework and really trying to do that. And then the next semester, I would talk to mom and she'd say, this is what's bothering us the most right now. He's really struggling with math. And I'm like, word problems. Okay, let's really tackle word problems. And so I'm like, is this all of those things or is this something else? I thought he has a global impact. We talked about motor and cognition. We've talked about all of those things. Persistence of problems again. Every time he has a new challenge, we talked about that. Memory and word retrieval have always been a big concern. Syntax. For some reason, syntax to me is one of the things that stands out the most. He has always had syntax problems. I never really put them as a priority. I never really thought about it being something that would help me give a clear diagnosis. I'm thinking about that now. So I didn't feel like there was one diagnosis that really accounted for all of those problems. So I started walking around our department and sitting down with people and kind of presenting this case. And we like to do that. It really helps us to talk it out. So I collaborated with colleagues here in our department and really started looking for the best practice and framework and knew I wanted to really think about, him as a whole person and his impact, and developmental language disorder articles and research started being handed to me and I started reading it. And I thought, I think that is the best description for him, developmental language disorder.
And I think that made you feel so much better about him. Because I feel like you would, at the beginning of the semesters, you're like, I got a plan. This is what we're working on. This is our focus. This is what I'm thinking.
Mm-hmm.
And near the end, she would come and be like, I don't know what I'm doing with this kid.
I know.
Am I making a difference? Because now
I would say that.
I feel like this is also an issue and I need to focus on this.
Yeah.
And I feel like I'm jumping around and I don't know what is the overall problem.
Right. And the reason that we're doing this in conjunction with our title of executive dysfunction or executive functions is because it is taking me back to those foundational skills. And everything I'm reading about DLD is talking about, narratives. It's talking about memory. It's talking about compensatory strategies, all of those things. So I was starting to feel better.
And you can't talk through a case on EF without talking about their primary diagnosis.
That's right. That's right. So developmental language disorder, by definition, for those of you who are not as familiar with it as some, is a developmental condition that impairs children's abilities to learn, understand, and use language appropriately for their age. It affects speaking, listening, reading, and writing without being explained by a cognitive impairment, autism, hearing loss, or limited language exposure.
What I like about this definition, what stands out to me in terms of being able to explain something to parents, is the neurodevelopmental condition, the
Yeah.
brain-based. We're past just, oh, they're just a little bit behind in their language skills, right? No, this is a bigger issue. This is a bigger problem. And I feel like that language helps answer the why a little bit for families.
Yeah. The other thing that she's making me think of that I think is going to come later is that developmental language disorder is a lifelong disorder. It's really not, we can make improvements and give them strategies to help them be more successful in different areas, but it's something they're going to be dealing with forever, which explains why, we're not meeting a goal and done. Problems associated with DLD extend beyond the linguistic domain. You can see them all listed there. We've got, of course, memory, phonological short-term memory, verbal working memory, problems with attention, executive function, also with processing, motor function, all of those things. And I saw my client, with all of those kind of problems at some point along the way. The other thing that I kept finding was this procedural memory, and it's really thought to play a role in learning grammar. So it suggests that children with DLD may have weaknesses in that procedural memory, and that makes it really hard to acquire some of those aspects of language, and that's specifically phonological skills. So going way back to first grade when he started really struggling with phonological awareness, that was represented at that time. This is just a visual kind of showing you how easy it is for DLD to be misdiagnosed. There's so much overlap in all of the symptoms, but you can see the areas of impairment in developmental language disorder versus just a language disorder versus a speech sound disorder. I don't think we want to go into. We'll come back to this. We have another little interesting connection, but we'll see if we have time for that. Okay, so now if I'm thinking about, okay, what do I do with this kid who has all of these kind of issues in a lot of different areas? If I think about the EF skills, what do I want to work on? I want to work on compensatory strategies for executive function. I want to teach him ways to inhibit. I want to teach him ways to plan. I want to teach him ways to monitor the tasks that he's doing. And I want to increase his awareness for using those skills. So you see here that, we gave him a visual. We wanted him to get a specific score on a rating scale for whatever assignment that we might have for him. We like to use curriculum-based assignments or homework that he has. He brings it in and we say, as you are completing this homework task that you have to do, we want you to use this stop, think, plan, do, evaluate. Now we're going to teach you how to use each of the steps within each of the stop and think, the plan. We want you to actually do it, although I don't care as much about the do as I do his ability to kind of evaluate that he did the steps. So he would start his assignment. We used the visual to kind of help himself complete the assignment, read the instructions, highlight or underline keywords, start it, get started. Sometimes just him getting started was difficult. And then checking to see if he met all the steps. And then we would ask him to fill out that rating scale, and we would fill it out too, to make sure that he recognized when he did stop and think, when he did plan, or when he actually did not plan. So we would use that rating scale, and that was our data. Our data was on the use of this visual strategy or visual organizer. And then we used that and gave it to mom for homework at night, gave it to school. It's on his desk so that he could kind of remind himself to use that. And we just had to keep practicing, practice.
I think it's important to keep in mind it's just not a one and done. Like,
Oh,
I'm just going to
gosh.
show you this once. This is something you can use. It's got to be something that you give a lot of explanation to and that you model it for them and show them how to use it, rehearse it. I mean, it has to, again, it's not a one and done. It's got to be used consistently because you want to hopefully make that intrinsic.
Right.
Right? So for them to not rely on that visual, but for them not to rely on that visual, it has to become so ingrained in such a routine.
Yeah, we're creating new habits. And when they start having success with that new habit, they're going to be more motivated to use that outside of us telling them to do it. So we were looking for, 3 out of 3, meaning I used all the components of the stop and think. I used all the components of the plan. I used all the components of evaluate. And it was going to take an entire semester to get to a point where he was doing that on his own.
One other thing from the other slide, just that very bottom box that talked about, make sure when you are developing your strategies that you keep them really short and simple because remember, these students often have language impairments, right? So we need to consider the language demand of the strategies that we're using with them. It needs to be easily understood, so comprehension of them and use of them, and the language, even within your visual, needs to be pretty simple. You need to make sure that it matches their skills.
And also, we collaborated with the teacher. Like, if you look at the evaluate box, we collaborated with it and said, what's important right now for him to be checking when he's looking at his work. And then we also asked, this client himself, what do you think you need to do? And we would add that to the list. So, if he wanted to underline versus highlight, we said, that's fine. Let's underline the word. So we collaborated with both client and teacher on that. The school provided us with vocabulary worksheets that we used to generate sentences. You'll see later us talking about some of the methods being use of a keyboard or use of AI. We let him, handwriting is very, very painful for him to do. And so we let him keyboard in, and it has spell check. We didn't care if it had spell check. That was fine with us. We checked with school. They said that's fine with us. So be flexible in some of those things that are going to make his life just a little easier. Okay, just a couple of clips here on auditory memory. Our goals, you can see at the bottom, number 2 and 3. Given a verbally presented 8-word sentence, the client will recall and write the sentence with accurate syntax, word order, parts of speech, relevant details, and accuracy. And then we also had another goal for a typed paragraph. We never got to typed paragraph, and you're going to see in this video that we had to really back up our write the sentence. We had to really focus on just orally recalling the sentence because he was struggling so much with doing this. So I'm going to show you a couple clips. The first one is him kind of talking out loud about the things he needs to do. And then this is when they were still trying to write it out. And then the second video that I'm going to show you is when he is just verbally recalling the sentence with some simultaneous recall with the clinician and some repetition. So first video, he was still trying to write. Let's take a look at that.
And then I'm really good friends.
He's talking about a girl first.
Oh man,
That's hilarious.
yeah. It's so weird.
Still
'Cause
talking
I
about
didn't know
this
this girl until like 5th grade.
Uh-huh.
And that.
Okay. You know the drill. We're gonna do our sentences, and I almost forgot our really important paper that we need. So what are the things that we are going to do when we're trying to remember our sentence?
Gotta keep it. Gotta say it in my brain over and
True.
over again.
True.
And we have to make sure this. We have to make sure there's exactly 8 words.
Good point.
So there's like one less than that's wrong if this one was less.
He has a visual pacing board that just has spots for 8 words so that he knows if he has said all 8 words.
That's wrong.
And we want to imagine
In our brain.
We want to imagine it in our head.
Like the cat was in the lab and eating something bad or something like that.
Right.
And then in the lab. Yeah.
Perfect. Okay. Yeah. And I am going to have you say them out loud. Because I think it's helping us, and I think it's important.
Maybe.
That way I can tell what words are harder for you to remember. Not remember, but to get wrote down.
Yeah.
And then we kind of, maybe we can figure it out. Okay?
Okay.
So we've got this, so we want to practice it out loud. We're going to practice it out loud. We're going to say it out loud. And then we're going to imagine it in our head what that sentence would look like. Okay? All right, here's your first one. Make sure the marker works. We gotta better check that. Oh yeah, that's good. Okay, here we go. The bright sun warmed the chilly. Sorry, I can't read today. Apparently, let's try a different one.
I said chili and the bright spot.
Yeah, no. Here we go. Students quietly worked while the teacher read aloud.
Students worked quietly while the teacher
Students quietly worked while the teacher read aloud.
students
Okay, really struggling
the teacher
to write those down.
Make sure that I can
Let me have you take a look at the second video.
Students quietly bright sun warmed the chilly morning air.
The bright sun warmed the chilly morning air.
Try it again.
The bright sun warmed the chilly morning air.
Try on once on your own.
The
Okay.
The bright sun warmed the chilly warm air. Cold air.
Close.
Freezing air. Moldy. No. Morning air.
Morning air. All right, let's do it together.
The bright sun warmed the chilly morning air. The bright sun warmed the chilly morning air.
Easy peasy. All right.
He said easy peasy.
She quickly grabbed her coat before the storm. She quickly grabbed her coat before the storm.
She quickly grabbed her coat before the storm.
Okay.
Dang!
And
You're
we
on
had
fire.
built that up from 5 words to 6 words, and now we were at 8 words. And then we tried to go to the writing it, but we quickly learned that that was a step too far. We really needed to go back and kind of work on some of this simultaneous recall. Okay, so taking a look at some methods, of course, multimodal visuals, checklists, graphic organizers are always going to be very useful. Teaching them self-advocacy, like what do you know, what do you not know? You can't just say, I don't know, or not start. Use of technology in collaboration with school, they said, we're on board with that. We can address, when it's appropriate, when it's not. Hands-on crafts in group activities. We did that with him, especially for self-esteem. We had him give instructions for a craft to 2 other clients here at the clinic, and he was kind of the teacher, the leader. And so he would give the instructions and help correct if they missed any of the instructions. Sentence completion, routines and repetitions, daily sequencing, a lot of describing, story retells, math fact routines, and grammar drills. All of these things you're going to find in kind of a framework or methods for developmental language disorder. These are all things that you want to focus on. So after kind of, putting this all together with him at the end of the semester, I came with a new clinical impressions, really kind of outlining this developmental language disorder and what it was characterized by, what some of the characteristics were, what his strengths were. So you can see that. And then now that I know about this, some of my recommendations for the next semester are going to be to administer the test of narrative language. I really feel like I need to wrap everything up into something that is functional and that we can kind of, do again with some of that intrinsic cueing and some internal cues. And then also I really want to continue to work on that procedural memory. I want to continue to work on compensatory strategies, and I want to do successful practice of some of those skills that are specific to him. I think I'm most excited about continuing to work on some of the memory strategies to kind of build that so that he can use that as his foundational EF skill to do some higher level things. A little bit of EBP on developmental language disorder if you're looking for it. DLD and Me it's a website that has some adults that have lived with developmental language disorder, and they talk about resources there. There's a great article that we got a lot of information out of. The Catalyst Toolbox is a resource for how to arrive or identify the developmental language disorder and give that diagnosis. And then specifically for EF, the source, Development of Executive Functions by Faye and Richard, is a great resource for EF activities, EF strategies. This is a great resource as well.
Okay, time to address them. Oh,
yes, so you can see our takeaways and we can look at some questions if you want.
yeah, this was a quick wrap up about client-specific intervention, but I think we should get to questions so that we have time to do that.
All right. You guys knew the answer to the last question for the directives.
When he was trying to, do his hand and his name, and I said, "Do you remember the last step?" Many of you chimed in on that.
Okay. Everyone just wanted to respond to that. We don't have a lot of questions here yet, so if you have any questions, you can put them in the chat box. While we're kind of waiting on that, we can take a look here at kind of some takeaways from all of our EPIC.
Yeah, so this was our last EPIC case. We had a series of 11. Mm-hmm. Is that right? And so we just wanted to wrap up our last one with just a reminder about client-specific intervention is really best practice. And that the point of all of our EPIC cases was just to kind of walk you through that process. Not so we could specifically teach you about one thing, but it's just about how to arrive at those client-specific goals and intervention. So just some takeaways we want you to always consider is to make sure you're looking at the background information. You always need to know why. What's the etiology? What's the cause? So important. Assessment information. Remember, diagnosis should not come from one test or one subtest that you really need to do in-depth assessment, identify trends over multiple, whether it's formal or standardized tests and informal to come to your overall conclusion. And that you need to consider the overall person to arrive at your client-specific goals. You need a profile. What are their strengths and what are their barriers? So asking yourself those impact questions that we went through. Consider that functional impact across domains. Think about comprehension, expression, speech, cognition, sensory, all those things. Mm-hmm. Make sure you're gathering input from the team to identify those treatment priorities. Involve the families. They're important people in this process. They know their kids better than we do. And so what's important to them? What does their child need to work on? And then finally, there's never a one-size-fits-all approach to any disorder area, and it's so important that we dig in to find a treatment framework and methodology specific to your client's profile and needs. Okay. Here's our socials and website. We would love for you to follow us and stay in touch with us. And I think...
Yes, I can. I had someone ask if we could go back to a slide. I'm going to do that. And then also someone asked about what is torticollis. Torticollis is a muscle weakness for a lot of young kids when they have difficulty kind of turning their head. A lot of these kids end up, I think, with some helmets and some different physical therapy to kind of work on that. So that's torticollis. This is the slide I believe that you were looking for and seeing the difference between developmental language disorder and language disorder. Okay. See?
Yes, it's in the
Yes,
neck.
muscle tightness
In the
and
neck
more
of
weakness.
babies.
Tightness, I think, is definitely a better description than weakness. So good. Thank you for that.
Somebody asked about concerns when he was a toddler. Did he have global concerns, global delay? So yeah, he had OT, PT, and speech. So yes, that was present early on.
And he, we had said we might come back to a little bit. I mean, I think there is a connection. He has a younger brother who is kind of going through some of the same kind of things that we saw with Simon. But I think an interesting comment about him, looking at this slide that we have up right now, actually.
He's currently we're currently concerned with his speech intelligibility.
The younger brother.
He has a significant expressive language delay, but also a diagnosis of apraxia of speech. And right now, that's his current concern because we can't understand what he's saying, right? Which makes it hard to participate in his preschool environment, makes it hard to get his messages across at home. But we're kind of, as we talk about him and his older brother, I'm seeing some language things with him. I think it's going to show up as he has more words. I think we need to do some receptive language testing on his brother at this point because I think we're seeing some of the same things. He has difficulty answering questions. The processing component, you can start to see some of that early on. He's just a little 3-year-old at this point, but there is in that article that we talked about or showed by McGregor and Goffman. You can get this on the ASHA website, but it talks about there is some family history of it. So you often see it in siblings and it might manifest a little bit differently. Like I think the younger brother has way more significant speech intelligibility concerns than Simon did as a baby, but they're both present. So I think that's interesting to think about too, the family history. And I know if you work in a school, you're likely to have siblings.
Yeah, I think, I think one of the most important things that I've learned from the developmental language disorder, it's taken a little bit of pressure off of like meeting these goals and being done. I feel like I need to focus more on some of the foundational skills as well as focus on compensatory strategies to make them as successful as possible. I need to spend a little bit more time on that DLD and me and kind of dig into that. We're going to have some really important conversations with family about kind of things that they need to incorporate into, his academics and into homework and different things like that. I think that he's going to be successful in whatever he chooses to do, and he does make progress, but I think that he's always going to have a struggle.
Yeah. And I hope a takeaway from this presentation too on executive dysfunction is maybe it alleviates a little pressure off of you as a school SLP who's like, how can I target one more thing in therapy, right? But what you're not targeting it, you're teaching them strategies and you're using those strategies to address other goals that you're working on. So I'm hoping that message kind of came through today too, as we talk about executive dysfunction, because you have lots of things to work on in such little time.
And you are the person to do it. You are the one. The SLP is the one who has the ability to kind of work on those strategies in not only in the classroom and with what they're doing, but also one-on-one with you in your therapy room. So, it's definitely worth thinking about. And if you're going to make progress that's going to generalize to other skills, you're going to have to address it.
Okay, so I think that concludes our presentation. We need to be wrapping up here. So thank you so much for joining us tonight. Thank you for participating and asking questions during our presentation. And this concludes our EPIC mini series. So if you've missed some of our previous ones, go check them out on speechtherapypd.com. Thank you.
Thank you.